Kidney damage can show up without warning, and every day about 50,000 people hear that news for the first time. What looks like tiredness, a swollen ankle, or a little nighttime urination can actually be the first whisper of a problem that was quietly progressing for months or years. If you want to protect your kidneys, you need to recognize the small signals before they become emergencies. I'm going to walk you through 7 silent warning signs you must not ignore, explain what's usually behind each one, and give one practical step you can take right away. First, a quick primer so you know what early kidney disease means. Kidney function is commonly reported as eGFR, estimated glomerular filtration rate, and it's the number doctors use to stage chronic kidney disease. The stages are: Stage 1, eGFR, 90. Stage 2, eGFR, 60-89. Stage 3A, eGFR, 45-59. Stage 3B, eGFR, 30-44. Stage 4, eGFR, 15-29. Stage 5, eGFR. 15 stages, 1 through 3A, are often silent. Labs might not trigger urgent alerts, you may feel fine, and routine testing can miss the trend unless someone checks the eGFR and urine for protein. That's why knowing the subtle signs matters. Pause and check your lab results if you have them. Look for your eGFR number on your most recent blood report. If you don't have recent labs, plan to get them. Now let's go through the 7 warning signs. 1. Unexpected high blood pressure, or blood pressure that's suddenly harder to control. High blood pressure is both a cause and a consequence of kidney stress. When kidneys are injured, they retain more sodium and fluid and activate systems that raise blood pressure. On the other side, long-standing high blood pressure damages the tiny blood vessels inside the kidney, reducing filtration. Insulin resistance and diets high in processed foods amplify this problem. Excess refined carbs and elevated insulin promote sodium retention, and processed food patterns often mean far more sodium than potassium, which worsens volume and pressure control. If your blood pressure is creeping up despite reasonable diet and exercise, or if medications that used to work no longer do, that's a red flag for the kidneys. Immediate action. Have your eGFR checked and measure urine for protein. Track blood pressure at home for a week and share the trend with your clinician. Small changes, cutting refined carbs, swapping processed snacks for whole foods, and increasing potassium-rich vegetables often help, but discuss medication adjustments with your provider. 2. Persistent, unexplained fatigue or low energy. Fatigue is common and nonspecific, but when it's persistent and not explained by sleep, depression, or thyroid problems, consider kidney function. Early kidney dysfunction produces low-level inflammation, toxin buildup, and sometimes early drops in erythropoietin, the hormone that helps make red blood cells, all of which sap energy. Insulin resistance also harms cellular energy pathways and mitochondrial function, so a pattern of long-term high blood sugar or metabolic syndrome can show up as tiredness tied to kidney stress. Immediate action. Check basic labs, eGFR, complete blood count, and fasting glucose or HbA1c, and talk to your clinician about whether further kidney-focused testing is needed. Improving blood sugar control through dietary shifts, fewer refined carbs, more fiber, more whole foods, often reduces systemic inflammation and can boost energy. 3. Changes in urination, foamy urine, increased nighttime urination, or reduced volume. The kidney's job is to filter waste while keeping proteins and important molecules in the blood. When the filter becomes leaky, protein, often albumin, spills into the urine, and that can show as foamy urine. If you find yourself waking up to urinate more often at night, nocturia, or noticing a drop in your usual output, that can also point to impaired kidney concentrating ability or early dysfunction. All of these changes may be subtle at first, but they are meaningful. Immediate action. Ask for a urine albumin-to-creatinine ratio, ACR, and routine urinalysis. If urine looks foamy or you've had new nighttime urination, bring a urine sample to your clinician and request those specific tests. 4. Subtle swelling, persistent puffiness around the eyes, ankles, or hands. Small persistent swelling can be one of the first visible signs of impaired kidney function. When the kidneys leak protein, you lose the blood proteins that normally hold fluid inside blood vessels. Fluid shifts into tissues, and you get puffiness. Sodium and fluid retention that follows reduced kidney clearance also contributes to peripheral edema. This swelling is often worse in the morning around the eyes or at the end of the day in the ankles. It may feel like shoes fitting a little tighter. Immediate action. Check urine for protein and ask about your daily sodium intake. Reducing processed salt-heavy foods, improving hydration balance, and discussing salt-sensitive blood pressure with your clinician are practical early steps. 5. Muscle cramps, sudden electrolyte imbalances, or frequent low magnesium-potassium symptoms. Muscle cramps, weakness, and periodic heart palpitations can occur when electrolyte balance is off. Modern processed diets commonly tilt electrolytes toward excess sodium and away from potassium and magnesium. Chronic dehydration worsens this imbalance, and some medications can deplete minerals as well. Kidneys play a central role in keeping potassium, sodium, and magnesium balanced. Early kidney stress can make those imbalances more likely and more symptomatic. Immediate action. Request basic electrolyte testing, sodium, potassium, magnesium, calcium, along with your eGFR. Increase whole food sources of potassium and magnesium, leafy greens, nuts, seeds, avocados, and improve hydration with a balanced electrolyte approach. But if you take potassium-sparing drugs or potassium supplements, discuss this with your clinician before increasing intake. 6. Recurrent kidney stones, frequent UTIs, or blood in the urine. A history of kidney stones or recurrent urinary tract infections increases the chance of structural damage and scarring over time. Stones can scratch and obstruct the urinary tract, and repeated infections can inflame renal tissue. Visible blood in the urine, even occasional pink or brown-tinged urine, is never a normal sign and should prompt testing. Some medications and conditions that cause interstitial nephritis can also create hematuria, blood in the urine. Immediate action. If you get stones, frequent UTIs, or any blood in the urine, ask for imaging and a nephrology or urology review. At a minimum, get eGFR and urine tests and review medication history with your clinician. NSAIDs and some other drugs can compound injury in these scenarios. 7. Persistent digestive symptoms, loss of appetite, nausea, metallic taste. When the kidney's filtering ability declines, waste products that should be excreted build up and can cause subtle gastrointestinal symptoms, decreased appetite, early satiety, mild nausea, or a persistent metallic taste. In small amounts, these might feel like bad digestion, but when they're persistent and unexplained, they can be an early sign of reduced clearance. Immediate action. Check eGFR and look for signs of toxin buildup via standard metabolic panels. Improve small, frequent meals of nutrient-dense whole foods and speak with your clinician about further evaluation. Now that you've heard the 7 signs, let's zoom out and look at what usually drives these problems. Understanding root causes helps you prioritize prevention. The main drivers that silently injure kidneys: insulin resistance and high blood glucose. This is one of the most important upstream drivers. High insulin and blood sugar levels damage small blood vessels, increase inflammation, and change how the kidneys handle sodium and water. That leads over time to scarring and reduced filtration. Processed food electrolyte imbalance: too much sodium, too little potassium and magnesium. Modern diets loaded with refined foods create an electrolyte environment that stresses kidneys, promotes higher blood pressure, and increases fluid retention. Chronic dehydration or poor quality hydration: not drinking enough, or replacing fluids with high sugar, sodium-heavy drinks, reduces renal perfusion and promotes repeated short-term injury. Damaging medications and overuse of certain drugs. Chronic or frequent use of NSAIDs is a well-known risk for kidney injury. Proton pump inhibitors, PPIs, and certain antibiotics have also been associated with kidney harm in susceptible people. These drugs are often essential and appropriate, but they need to be used with awareness and under medical guidance. Infections, autoimmune disease, and genetics. Recurrent infections, autoimmune attacks on renal tissue, and inherited vulnerabilities can silently reduce function over time. Kidney stones and structural problems. Repeated stones, obstruction, or congenital anomalies produce scarring and chronic injury. How these causes damage kidneys. The basic mechanisms. When any of the above pressures persist, several processes occur. Inflammation that injures filtering units, glomeruli, scarring, fibrosis that replaces healthy tissue, reduced blood flow to parts of the kidney, and cellular mitochondrial stress that lowers repair capacity. Over time, lost nephrons, the kidney's working units, reduce overall filtering power and lead to steadily lower eGFR. The good news is that in many early cases, particularly in stages 1 through 3A, lifestyle and medical adjustments can slow or sometimes partially reverse the trend. A practical prevention and early reversal toolkit. You don't need a perfect plan. Small, consistent changes tend to matter more than dramatic, short-term fixes. Here are targeted, evidence-minded steps that reduce kidney stress and support recovery when applied early. Diet and blood sugar control. Prioritize whole foods over processed snacks. Vegetables, legumes, whole grains, lean proteins, nuts, seeds, and fruit in moderation reduce insulin spikes and improve nutrient density. Patterns like the DASH or Mediterranean-style diets align well with kidney-friendly goals. Reduce refined carbohydrates and added sugars to lower insulin demand. This supports blood pressure control and reduces inflammation, both helpful to kidneys. Increase potassium-rich whole foods, leafy greens, sweet potatoes, beans, avocados, bananas, to offset excess dietary sodium. Note: if you are on medications that raise potassium, discuss increases with your clinician before making large changes. Keep protein intake moderate and appropriate for your health status. Extremely high protein diets are not necessary for most people and can raise renal workload. Tailor protein to your needs with professional guidance. Hydration and electrolytes. Improve hydration in a balanced way. Water is essential, but if you're frequently dehydrated or sweat a lot, include balanced electrolytes, not just sodium alone. Formulations that include magnesium and potassium are more kidney-friendly than sodium-only mixes. Avoid chronic overconsumption of sugary sports drinks. They add calories and can worsen insulin resistance. Minerals and supplements, cautiously. Magnesium and potassium support cellular and vascular health. They can help blood pressure and muscle function. Consider dietary sources first and talk to your clinician before starting supplements, especially if you have reduced kidney function or take medications that alter electrolytes. There's no single magic pill for kidney repair. Supplements are supportive tools when used appropriately and under supervision. Medication safety. Avoid chronic NSAID use when alternatives are available. NSAIDs can reduce blood flow within the kidney and precipitate injury in vulnerable people. For short-term pain, use as directed and speak to your clinician about safer options if you need long-term pain management. Review chronic use of PPIs and certain antibiotics with your clinician. In some people, these are linked with kidney risk and may have appropriate alternatives. Never stop prescribed medications on your own. If you're concerned about a drug's kidney effects, bring the concern to your prescriber and ask about alternatives or monitoring. Blood pressure, insulin, and stress. Control blood pressure through diet, minerals, exercise, and, when needed, medications. Healthy blood pressure is one of the most protective factors for kidneys. Work on insulin sensitivity, regular movement, resistance training, and dietary patterns that reduce large glucose swings help the kidneys indirectly. Reduce chronic stress with practical measures, sleep hygiene, breathing practices, and regular physical activity. Stress increases hormones that can worsen blood sugar and blood pressure over time. Environmental toxins and medications. Minimize unnecessary household chemicals and avoid repeated exposure to harsh solvents when possible. Reduce cumulative toxic load by choosing safer cleaners and limiting exposures. Use antibiotics only when indicated and follow prescriptions exactly. Misuse heightens the risk of adverse effects, including for the kidneys. Testing and monitoring. Essential tests to ask for: eGFR, urine albumin, ACR, routine urinalysis, basic metabolic panel, electrolytes, fasting glucose or HbA1c, and if relevant, magnesium level. If you have a history of stones, imaging and stone analysis may be useful. Track trends over time. A single lab can't tell the whole story. Watch changes in eGFR and urine albumin across months. When to see a specialist. A clear clinical boundary. If your eGFR is 45 or lower, that is, stage 3B or below, if you have rapidly declining labs, persistent severe symptoms, or significant urine protein, you should see a nephrologist, a kidney specialist. Advanced stages often require coordinated medical management beyond lifestyle changes alone. Also, if you have complex medication regimens, recurrent kidney infections, or structural kidney issues, seek specialty input early. And again, never stop or change prescribed medicines without direct guidance from your clinician. A few practical examples to make this real. Someone whose blood pressure suddenly becomes hard to control after years of stability should check eGFR and urine protein. Sometimes what looks like resistant hypertension is partly kidney-driven and responds to targeted dietary and medication adjustments guided by labs. A person who wakes up multiple nights to urinate and notices a bit of foam in the toilet likely needs an ACR and eGFR. Catching proteinuria early opens the door to treatments that reduce progression risk. If you've had recurring kidney stones, adding modest hydration improvements, adjusting diet away from high-processed sodium foods, and asking your clinician about stone prevention strategies could reduce future kidney scarring. What to do right now? A short checklist you can act on today. Find your most recent lab report and locate your eGFR number. If it's been more than a year or you don't have one, schedule labs. Request or confirm urine albumin, urine ACR, and a basic metabolic panel that includes electrolytes. Cut back on processed foods and refined carbs. Add more whole vegetables and potassium-rich foods. Improve daily hydration with plain water and, when needed, a balanced electrolyte option that includes magnesium and potassium. But check with your clinician first if you take potassium-altering drugs. Review any chronic NSAID, PPI, or frequent antibiotic use with the prescriber. Ask about monitoring and safer alternatives if appropriate. Track blood pressure at home for a week and bring the results to your next medical visit. Final recap. Kidney damage can be silent, and early stages often look like everyday complaints, fatigue, swelling, subtle urine changes, or harder to control blood pressure. The more you understand these signs and act early, the better your chances of slowing or sometimes improving kidney health. Many early problems can be addressed with practical lifestyle shifts, safer medication use, and targeted testing, but advanced disease requires specialist care. Get screened. Ask your clinician for eGFR and urine protein, ACR, tests. Discuss any medications that worry you, and start simple lifestyle steps today. I have listed the essential lab tests in the description below, including eGFR and urine albumin. Use that list to talk to your doctor. Take that next step. Checking your labs could be the single most important move you make for your kidney health.